Alright everyone, I'm going to do a video about, I don't even know what to title it, like my experience with mental health services in the NHS or something, I guess. I don't know. It's going to be mostly about depression and anxiety, because those are the mental health problems that I've been suffering from, and just my problems with the treatment and diagnosis of it. And what I've experienced so far. So like, I've been experiencing like severe depression for the last 3 or 4 years, I think. I can't remember how long it's been. It's been like a lifelong thing, but the last few years it became really bad, to a point where I felt like I couldn't really cope with it anymore. Before that, it would come and go, and I would just be able to wait it out. But after an illness, it just kind of came and stayed forever. You know what I mean? Like constant, like years and years of just a low mood and anxiety and really bad depression. So I went to the doctor to talk about it, and I don't know, I want to talk about my experience of the doctors, the problems I've had, and just what the treatments that I've been given, which have bothered me. So like the first doctor I went to was really nice, and she like was asking me like questions about like the symptoms and all this, giving me like advice on what kind of treatment I could go for, and like the pros and cons and all this. And I was really against going on antidepressants at the time. I didn't really know much about them. So she said that there's this like service called talking therapy, which is like counselling, or that kind of thing. So she said give that a try. She said that's probably like the best thing, and I think she'd actually been through a similar thing and done like the therapy and all that, and was able to recommend it. So I went to the therapy, and I did I gave it a good go. I think I quit like 2 weeks before my last 2 sessions. I quit I think I skipped my last 2 sessions because I'd gone through months of it, and I just felt like it was no better whatsoever. My experience of talking therapy, I don't know if everyone has this experience, or whether I don't know. I felt like I wasn't really getting a very good service from it. I felt more like I'd have to be talking about how I was feeling, and it'd be more talking because it's talking therapy. And some of the advice was good. It was like advice about getting out there and doing more. Like the whole gist of it is like you kind of, if you feel depressed, and then your actions are as a result of that. Like you don't go out the house, and that reinforces the depression because you're not going out the house, and then so you stay in, and it kind of like becomes a vicious cycle. Problem is that like almost everything I talked about, I was either shown a chart that showed the same thing, basically like a circular chart with something up here that leads onto something here and leads onto something here. How everything is, how behaviour reinforces your mood, and your mood reinforces your behaviour. There's only so many charts like that you can look at before you think, yeah, I got it the first time, you know what I mean? And I know this, it's like, I know that I have to get out of the house more to improve my mood. And to be honest, since then I've tried all these things, and I found I get such bad anxiety when I do try and go out and do something that it doesn't improve the situation, it makes it worse. So anyway, another problem I had was, instead of, if it wasn't looking at charts, it was watching YouTube videos for some reason in these therapy sessions. It was like fucking, I'd be talking about something, a feeling I was having or something, and then she said, oh well, let's watch this video. And it was like YouTube videos of, I guess like psychology people have uploaded it, I don't know. Or it was videos she had saved on a computer, and it was like, I remember one where it was like, hey, I'm on the feelings bus. Oh no, a bad feeling's just got on. And there's like a stupid cartoon of someone driving around a city, and it's about all their feelings being on the bus with them, and oh, fuck knows, I can't remember what the message of that video was, but it was about this point that I was watching this video and thinking, these are stupid. Like, I get the message behind them, but I'd much rather have these messages discussed. You know, I'd much rather have it, you know, just have a grown adult just talk to me about these things, rather than making me watch stupid cartoon videos on YouTube, which I could just sit at home and do that if I, you know what I mean. I don't need cartoons to make me get a message. And another thing I had a problem with that therapy was that at the beginning I was asked to fill out a form, and it was about like, how often do you feel depressed every day? You know, how often do you feel these feelings? Do you stop going out because you feel you may have anxiety? And towards the end of the therapy I was asked to fill in the form again, and it pretty much I'd pretty much ticked the boxes exactly the same. And the therapist said, well, you know, you haven't really improved, let's go through the questions. So, but what about this one where he says you feel depressed every day? Do you feel like that constantly, all day, every day? You know, I said, well, no, you know, sometimes my mood, you know, is better than others. Sometimes of the day it's better. You know, I might not be like completely depressed all day long. I might have a bit where, you know, I'm enjoying watching a TV show or something, so I might not feel so severely depressed as I do like at the start of the day or something like that. So, oh well, you know, this really means, do you feel this all day long as a constant? I'll just put that you don't tick. And went through these questions one by one, and by the end of it I suddenly had a much higher score. But then I thought, well, if she'd given the same scrutiny to those questions when I first started the therapy, it might have been the same, you know. So I felt like I was being kind of manipulated into giving the appearance of having an improvement in my condition where I really didn't feel like it. So I quit that after, like two weeks before the end of my, you know, before it was supposed to finish anyway, because I just felt like it's pointless. It's wasting my time and her time going there. So I went back to the doctors a few months later. Things still hadn't improved really. If anything, it had got worse. You know, I was becoming increasingly like shut in and finding it hard to go out, and you know, I didn't really. It's the same now. I don't really hang out with anyone apart from my wife. You know, I don't really like have a friend, like a big friend group or anything. But I went back to the doctors and I said, like, I want to give antidepressants a try because the therapy wasn't working. So she put me on sertraline, which I did video diary about, and I only lasted a few days. But she didn't really ask a lot about the condition before she put me on sertraline. You know, I always feel like with any other medical condition there'd be some kind of test, you know, before they put you on some medicine, you know, at least listen to your heart or I don't know, something like that. There didn't really seem to be any of this, and like I just felt like, well, you could just go in and just pretend to be depressed and just get put on some antidepressants. I don't know, I didn't really know what I expect from some test, but I expected a little bit more scrutiny or something. So I don't know. I guess I've just got to listen and believe when you say that you're depressed. I guess, I don't know. But I remember asking the doctor. I said, "Listen, I'm really worried about like the side effects. I've heard bad things from people. You know, people saying they've become addicted, and you know, and it makes them just like feel sleepy all the time." And she said, "Well, don't worry about that. You might feel a bit dizzy for the first couple of days, but then you'll be okay." So I started taking them, and after 4 days, I still felt extremely dizzy, and I'd been making like a video diary, and then I went and looked online, you know, because I was thinking, oh God, I can't take these side effects anymore. It just felt awful, and people were saying it felt like this for months, like 2 months or more. They were just getting these effects, and it was just going on, and all these like sort of things that I should have been told to consider before taking this medicine, you know, like, you know, the lifelong effects of taking something like that, or like, I don't know, just the problems of taking the antidepressants, which weren't discussed to me. It was just sold to me like, oh, you'll feel a bit dizzy at the beginning for a couple of days, and then you'll be fine. and so I stopped taking them, and I can't remember how long it's been now. It's been months and months. I guess I just kind of felt like I didn't really know what else to do for help. I thought maybe I'd just do nothing. I don't know. And recently, I felt like I've got to do something. I think the most recent thing that made me think, like, fuck, I've got to go and get some help, was I basically become a bit of a shut-in. Like I say, I only really go out places with my wife, or go out to work. But going out like friends, socialising, I don't really do anymore because I get really bad anxiety. But my friend's stag do was in Amsterdam, and I went along to that because, you know, I can't really say no to my mate's stag do. But it was like a 4-day thing, and once I got there, I started having this panic attack, and my heart was just pumping really fast, and I couldn't breathe properly. And this panic attack felt like it lasted for the straight 4 days that I was there. I couldn't really socialise with all the people there. I was meeting a lot of new people, and I just couldn't socialise. I was like sweating profusely all the time. I was just like, I just couldn't enjoy myself. I was really quiet and awkward, and, you know, I'm quite introverted anyway normally, but this was like ultra introversion. I just couldn't socialise, and I couldn't enjoy myself, and I felt really ill the whole time. I couldn't eat anything, and I don't know, that was kind of one of the things that made me think, fuck, you know, there's something not right in my head. It's not just normal, like, I don't know. But anyway, and then I also realised, like, a couple of weeks ago that, like, since that, which was in March, this stag do, I haven't really done anything with anyone else, like been out or done any socialising or seen any friends. So it kind of made me think, fucking hell, it's a long time to just like not do anything, just stay in the house, and just generally still being depressed even after all these years. I went back to the doctors, and I said to the doctor, you know, I tried sertraline, I tried the therapy. I didn't really like the sertraline because I was told the effect, I would only get a couple of days of side effects, and then I said, when I looked it up online and saw all the problems people were having, I kind of felt a bit misled. I said, you know, I really want to get some more advice from the doctor before I take something. She said, well, I'll put you on this fluoxetine, which is what I've been diagnosed, what I've been prescribed now, which I think is Prozac. I said, okay, well, can you tell me anything more about it? She said, well, the main side effects is nausea and dizziness in the first week or so, but that will pass. I was like, okay, well, is that it? Is there anything else? No, there wasn't any more information given, and I was really saying to the doctor, like, you know, please give me more information. I want to make like an informed decision. But there wasn't anything like that. It was like that she was just trying to get me out the door, bung me on Prozac, send me out the door, see how I do. She didn't even ask about the symptoms or anything, you know. She wasn't even like, there wasn't any attempt at any diagnosis then. I guess because I'd been on it before, she must assume that the other doctors had done it, but, you know, she didn't really. I just said I was depressed. Oh, okay, here's some Prozac. But my main issue is, oh fuck, there's a leaflet, right? You get a big, bit of nausea and dizziness, that'll be fine. Let's have a look at the actual side effects. So here they are. Well, serious side effects, other side effects, which I know a lot of medicine has these things on, but the main thing that bothered me, right? God, where's a bit? There's a bit in here which, when I read it, oh yeah, Like all medicines, it can have unwanted effects. It is therefore important that you and your doctor weigh up the benefits of treatment against the possible unwanted effects before starting treatment. It says right there on the fucking in the packaging, you and your doctor need to weigh up the benefits against the side effects. Where was that? Where was this weighing up of benefits and side effects? You know, the long-term side effects of taking this, which are described in the leaflet, and which I've had to go online to look at myself because I don't get the information I want from the doctor. You know, I always complain about people just giving me stupid medical advice in the comment sections and things, because it's like, it's just, oh, you've just gone on a blog and read it. Well, you know, I'll get the advice from my doctor, thanks. But in the case of depression, I've just never had fucking, you know, I've got better advice from online. You know what I mean? Like, the only advice I've been able to find is looking it up myself online. And this isn't like some professional medical advice I'm getting. It's just fucking, I don't know. The best stuff I got was from watching other people's videos of talking about taking this drug and their experiences with it, which is kind of the advice I would have wanted from my doctor, but I didn't get. So anyway, I'm going to start doing another video series where I take fluxoetine, or whatever the fuck it's called, talk about the side effects. But I don't know, I wanted to talk about that because I find, I don't know what mental health services are like for people with other like serious conditions, you know, like bipolar or schizophrenia or, you know, things like that. There must be different medical health services for them, but for the treatment of depression and anxiety, and which is not just me, oh, I'm feeling a bit down, it's been years of a constant depression and terrible anxiety to the point where it's affected my life and my job. I just found the services a bit lacking, to say the least. Very sort of lackluster. I wasn't given the information that I should have been given, I don't think. I don't know whether the doctors just don't know about these things as much as they do about like physical medical conditions. But I just feel like every time I've been, apart from the first time where she did sound like she was listening to me, I just felt like it was kind of a bit lackluster and a bit sort of, oh well, just take these and see how it goes, you know. Okay, so I'll probably start taking these tonight and we'll see how the effects go. Another place, when I was going to therapy, I was sent to go to the website Calm. I think it was Campaign Against Living Miserably, which apparently is a charity set up for men with mental health problems, especially depression, anxiety. What a load of fucking bollocks Calm is. It's just an advert for Top Man and links. It looks like a fucking magazine or something. Honestly, this is the kind of help you get. Oh, go online and look at this shitty website. It looks like a copy of Big Issue, that website. You know what I mean? I don't know what it is. Just, it's not any help. Anyway, thanks for watching, everyone. I don't know whether you've had better experiences with the NHS and similar things, but I don't know. Let me know if you have or whatever. Okay, see you later.